Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the Korea Disease Control and Prevention Agency on the COVID-19 outbreak. The daily number of confirmed cases has returned to double digits at 77 on Saturday. The country has seen over 100 cases daily for the past 3 days. Among these 77, 66 were local transmissions, and most of them are from places that are vulnerable to cluster infections, such as senior centers and medical centers. The briefing has just begun, so let's take a listen.
Let us now begin our regular briefing for October 24th on the COVID-19 response here in South Korea. Total, we have 66 new local infections today, and the total caseload now stands at 25,775. And we have 117 more people being discharged, while 1,484 people still remain in quarantine. And there are 60 patients with severe or critical conditions, and unfortunately we had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now take a look at the major updates on domestic infections by region. First of all, starting from the Seoul metropolitan city, in relation to a family in Kurogu district, we have the first index case being identified on the 22nd of October. We have 12 additional patients, and 13 in total have been confirmed to date. And in relation to social gathering in Gangnam-gu and Seocho-gu district, we had additional cases, and 29 have been confirmed to date. In relation to Unsporax community in the Gwanak-gu district, we also have additional cases being confirmed. And moving to Gyeonggi-do province, in relation to the Haengbokke nursing home, we have 11 new cases being confirmed. A total of 46 have been confirmed to date. And in relation to a healthcare facility in Gumpo City and care facility in Anyang City, we have 3 additional cases, bringing the total to 37. And in relation to the SRC Rehab Hospital in Gwangju City, we have 4 additional cases. A total of 128 people have been confirmed to date. And next, in the non-metropolitan areas in Busan City, in relation to a Pyeonggang Nursing Hospital, we have additional cases. 17 have been confirmed to date. And in relation to a family in Daejeon, we have 2 additional cases. A total of 33 have been confirmed to date. And also in Daejeon, in relation to the Chungnam National University Hospital, we have 2 additional cases, bringing the total to 6. In relation to a social gathering in Cheonan, we have 2 additional cases, bringing the total to 24. And we will also continue to note that as for remdesivir, the treatment, it has been administered to a total of 671 patients across 63 hospitals here in South Korea. And as for the development of the antibody treatments, we are also carrying out 6 types of testings for 6 types of DNA strains, and we have confirmed that it had competencies in resisting all of the 6 strains of the virus. And in relation to the live treatment, live quarantine measures, we have the safety e-report, which is being operated by the Safety Ministry. And here are some examples. And first of all, there were a report in relation to a restaurant, and they did not stick to the quarantine measures, including having a registry as well as having the checking of the temperatures. And also at religious centers, people did not wear face masks, and also they shared meals together. And these were some of the reports that we also had. And we also had a report on that the people did not wear face masks properly at indoor gyms as well. And the quarantine authorities will also continue to note that we have seen some of the facilities that are vulnerable to cluster infections, including nursing hospitals, nursing homes, and long-term care centers. And we also would like to continue to ask for these facilities to comply with quarantine measures. As for all of the managers who are working at these facilities, they need to wear face masks properly. They need to wash their hands on a regular basis and disinfect frequently touched areas areas as well, and also ventilate the space on a regular basis. Moreover, if you have any symptoms, and you need to check your symptoms on a daily basis as well, and if you have symptoms, please get tested for the COVID-19 as soon as possible. And at the same time, if you have symptoms, you need to also refrain from working at these hospitals so that we can cut the transmissions of the infections going forward. Moreover, we also have some concerns about the upcoming Halloween day. And please note that the COVID-19 can spread at any place, at anywhere, where it's crowded, confined, and close contact environment. So if you have symptoms or respiratory symptoms, please do not go to these Halloween gatherings. And also please refrain from going to multi-use facilities as well if you have symptoms. If you have to visit these facilities inevitably, please reduce the time of your stay there. And also, if you have any symptoms afterwards, please get tested as soon as possible. Wearing face mask properly is also very important. You need to keep at least 2 meters of healthy distance and also wash your hands on a regular basis as well. Moreover, please minimize any physical contact and also any activities like respiratory droplets travel that could induce these respiratory droplets travel, including singing or chanting. And please do not share your glasses when you are drinking together. And also, these facilities need to designate a responsible employee in charge of quarantine measures to check the visitors' entry log and also screen everyone's body temperature as well. And please also abide by these social distancing measures. And also during the weekend, we ask you to minimize social gatherings as much as possible. And if possible, please rest at home with your family members. And if you do have to go outside, please enjoy your weekend with where people are less crowded. And last but not least, we have a few words for the public as well. And we are nearing winter, and as we have worried in the Northern Hemisphere, especially centering around North America and Europe, we are seeing a massive outbreak of COVID-19, which is even larger than that of the before. So we believe that compared to our domestic situations, the other countries are going through even grave conditions. However, we are able to contain the virus to a large extent. On a regular basis, on a daily basis, we have also large cluster infections that are taking out and that are breaking out at multi-use facilities and vulnerable facilities. And also, however, we also would like to note that at health facilities and nursing hospitals, these are the venues of the major cluster infections, and we believe that we still have a lack of some of the sufficient control of the virus to a large extent. And going forward, we will also exert our full efforts to develop our vaccine and treatment. And in order to before the day we have these effective vaccines and therapeutics, we believe that we do not have a radical change in preserving and protecting ourselves from the virus. It is very important to minimize and reduce the fatality rate through extensive testing as well as early testings. And also, second, it is about cutting off the change of transmissions throughout the community as well. And last but not least, third, it is also about strengthening those from overseas so that we can cut entry from these imported cases as well. However, on the underlying surface, we also would like to note that the social distancing measure is ever more important. And as time goes by, we are seeing some visible results of the development of the therapeutics and vaccines here in South Korea. However, underneath all of these efforts, it is very important that we have our social distancing measures as well as washing of our hands and wearing a face mask. We also would like to highlight the need for quarantine measures for those in the young age group as well as the medium age group. And at workplaces and also at other gatherings which are crowded, we need to also highlight the importance of wearing face masks and keeping healthy distance and also washing your hands on a regular basis. And also note that you need to get tested if you have symptoms. These are some efforts that could protect the valuable lives of our senior citizens. And under the adjusted social distancing levels, we believe that our public also exerted their full efforts, and I continue to have great confidence in the members of the public as well. And as a member of the quarantine authorities, I have great pride in the energy and the potential that is possessed by our public, and so we ask for you to continue to exert your efforts going forward, and please make sure that this efforts continue out throughout the weekend as well, and please select these multi-use facilities as well. Thank you very much.
There you have it. We'll bring you more details on the briefing in our upcoming newscast at 6 p.m. Korea time. Until then, goodbye.
Autumn is in full swing in Korea. It's the season for outdoor activities, but remember that COVID-19 preventive measures come first. Refrain from hiking in groups and minimize the number of people accompanying you. Wear a mask if you cannot keep a 2-meter distance